one of the goals of MAT, medication-assisted treatment during pregnancy, is to even that out for the baby, to make sure for the baby that that environment is as stable as can be, and we're avoiding that that high and that low from the medication or from the illicit substance that mom may be using. So about that medication-assisted treatment, this is the list of the principles of effective drug addiction treatment from the National Institute on Drug Abuse, and just highlighting that medications are an important element of treatment for many patients, especially when combined with counseling and other behavioral therapies. When we look at medication-assisted treatment for opioid dependence as part of a comprehensive treatment program, these kinds of outcomes have been demonstrated for many years, for decades of research, that we understand that the complications during pregnancy, that there is a decrease in illicit opioid use, all of those kinds of benefits happen when we're able to intervene with mom and establish her on medication-assisted treatment. I'm not going to go through the detail of this chart. Again, you'll have this PowerPoint. If you have questions about this, please do email us. We'll be happy to respond to this kind of information and point you to the research behind this. But the kinds of medications that can be used to treat opioid dependency, somewhat different from methadone, buprenorphine, or naltrexone, and important to know about opioid treatment programs that are certified by SAMHSA, that are the dispensers, if you will, of methadone, versus physicians and psychiatrists who are granted waivers in order to prescribe buprenorphine and Subutex or Suboxone for people with opioid dependency. And again, more information is available on that so that you have a better understanding of what an opioid treatment program is. But important to know that each medication varies in its ability to reduce withdrawal symptoms and reduce drug craving, which is an important component during pregnancy so that the pregnant mom doesn't return to the illicit heroin use or going back to that up and down cycle, if you will. It's important to note that doctors need to determine the appropriate type of medication, the dosage and duration based on each person's biology, their addiction history and severity, the life circumstances and needs. I probably don't need to